Dr. Myers, Dr. Derm, hello. Medical Botox. We primarily in dermatology think of this when we're doing for excess sweating or hyperhidrosis or migraines or TMJ, temporal mandibular joint pain. Let me tell you a little bit about those. So for hyperhidrosis, we use this in the armpits. Typically, we can use this on the hands and feet also, but it's FDA approved for the armpit, and it does great. It's just expensive. For the migraines or headaches, we use Botox in areas on the head. So where do we primarily use it for migraines? Frontalis, temporalis, the globular area, the occipital scalp area. There's a few areas in the back there, and then the cervical neck and the trapezial neck, even onto the shoulders. Those are primary areas. What do we look for in these patients? We look for areas that are more painful. And you can do on-label or off-label. Almost everyone we do off-label, which is we basically put the Botox in the areas where they need it the most and in the areas that I think are going to give the best benefit for the patient. One thing that we also see, if you are a clencher, you clench down tight, you can have enlarged temporalis muscles. If you're a grinder, back and forth, you're going to get enlarged masseter muscles. And then you can have a combination of both. We have both enlarged temporalis and enlarged masseter muscles. These are great areas to inject Botox to help with this TMJ pain. And so we do that quite often. Even sometimes I'll do a small amount in the pterygoids, which are muscles that are a little bit deeper around the TMJ joint. The one bummer is, though insurance should cover this, most of the time they don't. I mean, we do occasionally get it covered, but most of the time people have to self-pay for these, even though they're approved things, which is kind of a bummer, but it's really neat to have them in our arsenal. I usually change this Botox from the cosmetic Botox, even though it's the exact same thing. I use a tiny bit different dilution. It's a little bit more hyper dilute. You're even using the same amount of Botox, but you're using more saline that you mix with it, so it spreads more. So it's not as concentrated, but you can cover more area. And I'd say most patients do that, especially in, say, the frontalis and temporalis and masseter muscles and all those on the back of the head. Hope that helps, knowing a little bit more of how medical Botox is used in dermatology. Thanks for watching.